Hi, my name is Dan Stone. I'm a specialist of urogynecologist, also known as female pelvic medicine and reconstructive surgery. So a urogynecologist specializes in the treatment of pelvic floor disorders. So this can include, or at least some of the common conditions that we treat are going to be urinary leakage, overactive bladder, and pelvic organ prolapse, which is a protrusion of the pelvic organs such as the bladder, rectum, vagina, uterus, through the vaginal opening. I always listen to my patients and really try to understand what they're going through. I want to know their goals, their values, so that we can come to a decision together on how to proceed with the management of these disorders. So once a diagnosis is made, I take the time to discuss the different options that are available to the patient. And usually this includes conservative options as well as surgical options if applicable. I really try to take into account their values, and together we come to a decision on how to proceed. So the pelvic floor is a group of muscles and connective tissue and bone in the pelvis that holds up the pelvic organs. And so these pelvic organs include the rectum, bladder, vagina, uterus if it's still there, and together it helps these organs function properly. In general, these disorders are caused by a weakened pelvic floor. And due to this weakening, the function of the bowel, bladder, rectum, and vagina are all affected. Oftentimes with these conditions, there are several conservative measures that can be taken to help treat the condition. These treatments include pelvic floor physical therapy or muscle training, also called Kegel exercises to strengthen the pelvic floor. There's dietary techniques that can be used. There's a technique called bladder retraining, especially for overactive bladder. And then there's pessaries that can be used for pelvic organ prolapse that holds up the pelvic organs to prevent them from falling down. So when and if surgery is decided on, I use minimally invasive approaches to perform the surgery. And this offers several advantages. It offers decreased recovery time and decreased pain so that people can get on with their lives as soon as possible. There's not one single cause of pelvic floor disorders, but instead risk factors that affect someone's risk of developing these disorders. So some of these risks include how many babies someone has had, how big these babies were, age, menopause status, weight, smoking status, chronic constipation, and genetics play a role as well. If you or a loved one suffer from one or more of these conditions, please give our clinic a call at 602-788-1521, and myself or one of my partners would be happy to see you. We are located near the 51 and Glendale Avenue in Phoenix, Arizona. Thank you for watching, and we look forward to hearing from you.